Hi there, thank you for joining us today. We're coming to you live from the HSS Werner Children's Pavilion here with our pediatric patient Michael and his mom Jill. They've both been kind enough to come here from New Jersey to talk about Michael's experience at HSS. He was here with a team of orthopedic surgeons working on his torn meniscus and his ACL a couple years ago, and we're here to share Michael's story, some of the inspiration behind an organization that he created as well, and to answer any questions that you might have. So remember that as you watch this video, if you're looking to start or change any treatment, first consult with your physician. But other than that, we're here and we're going to start with Michael's story. So I guess first off, Michael, school's starting soon, huh?
Yeah.
What grade are you going into?
7th grade.
Playing any sports this year?
I'm playing basketball, baseball, and flag football.
Okay. So you're all ready? School starts next week?
Yep.
Okay, great. I'm sure Mom's excited for school to start as well.
Yep.
So
it's time.
It's time. So we know a couple of years ago you were out on the baseball field, and what happened?
I was pitching in a baseball game, and I'm not really sure what happened, but I heard a pop in my left knee. I came out of the game, and I wasn't in too much pain, so I kept going in the game. And then after that baseball game, I went and played a full soccer game. And after that, I was in a lot of pain, so I went to a doctor.
So you knew right away at that point something was wrong. And Mom, were you at the game when the baseball game when it first happened?
No, I wasn't. We actually didn't realize at first how severe the injury was. His knee didn't really hurt or swell up too much until the next day. We went to the local emergency room. We went to a local orthopedist and left with the diagnosis of a knee sprain and a brace and some crutches, and went on. And when a couple weeks later his knee was still locking and he wasn't able to straighten it, we went back to this doctor. He performed an MRI and was still sticking with the sprain diagnosis. So at that point, then we started realizing we thought we needed to pursue something a little bit more. So we asked around, and we had a friend of a friend who was a physician's assistant here at HSS who recommended Dr. Allen to us, and we called him for a consultation.
Gotcha. And as a parent of obviously a child who's playing youth sports, what was going through your mind at that point? Were you, share with us a little bit about that.
I think at that point early on, I don't think we ever thought it would be an ACL tear. I think we just thought maybe it was a sprain, and we were very surprised at the diagnosis because at the time Michael was 9, and it's pretty unusual for a 9-year-old to tear their ACL.
Right. And do you remember, that at that point, were you scared when you knew that you had to go see some more doctors?
Not really, because before I came here to HSS, I already have seen a lot of doctors before.
You're used to it?
Yeah.
And then when the friend of a friend referenced HSS, had you heard of HSS before?
I had heard of it. We didn't really have any personal experience with it, but we had heard of it. So, and luckily we're in a suburb of New York. We live in New Jersey. It's not too far. It was easy to get here. Dr. Allen was great about getting us in very quickly, and actually got Michael into surgery that same day for the torn meniscus, which was also not what we were expecting.
And before you saw, and that's Dr. Answorth Allen for those tuning in, so before you even got to Dr. Allen's office, had you done any other online research or heard about HSS in US News, or did you just take the advice of your friend and go from there?
We did take the advice of our friend, but we had heard of HSS before, and we did do some additional research. And when we saw how highly ranked HSS is in orthopedics, we realized that this was definitely the place that we wanted to at least start our journey.
And so when you went in for that consultation with Dr. Allen, and I guess he presents to you the different treatment options, do you remember that meeting at all, or anything that you can share from that point?
I do remember in his office, they took very good care of us. I think they realized it was a scary experience. Michael was 9. We weren't expecting that they were going to tell us that day that he needed surgery right away. His physician's assistant was really with us through the entire day, kind of staying with us and talking us through the process. There were other people from the office who talked us through it, and we were fortunate that he was able to get Michael into surgery that night. And it also, thankfully, it was an outpatient surgery. You know, there were little things that people here did, like Michael and I were talking about this earlier today, like helping us find some place to charge our phones. We came in the morning with, you know, a backpack, and that was it. We weren't expecting that Michael would be staying here for surgery. We didn't have things with us. They helped us figure out where to park our car, where we could get our car out when he was discharged, how we could charge our phones so we could reach our other child at home and figure out what he would do. So they were great about kind of helping us manage the whole situation beyond just the surgery itself.
Meta, do you remember the surgery at all or no?
Not really. 3 years ago.
Yeah.
Seems like a long time.
Yeah, but mom remembers the surgery,
Yeah.
though, I'm sure. And in terms of the surgery itself, do you remember any questions that you were asking Dr. Allen at the time, or any concerns that you had, obviously, of a 9-year-old now going in for surgery?
Yeah, I mean, I think we were concerned about basic things like, you know, he had never had general anesthesia before, so thinking about how that was going to be, and speaking with the anesthesiologist, and you know, we met at length with a pediatric anesthesiologist before his surgery. We called our own pediatrician at home. We spoke with our pediatrician to make sure he didn't have any concerns about Michael having surgery. So, you know, it was, I think on some level, it was a good thing that it happened so quickly because we didn't really have time to worry too much. And we went ahead, and that surgery, it was just for his meniscus because the ACL was a much more complicated procedure that he was going to need, you know, different surgeons to handle. And we knew that going in, that if the ACL needed to be repaired, that wasn't going to happen that day.
That was actually going to be, you know, my next question is, you know, when you found out that this all couldn't be done all at once, and you had to first start with the meniscus, you know, what were some of the thoughts going through your mind at that point?
Oh, that's a good question. I honestly don't even remember. I think we were just thinking about the more immediate task at hand. Okay, we have to get this surgery done today, and the other thing that Dr. Allen told us is, once I go in and I can actually look at the ACL and I can see what it looks like and I can see what that tear is, then we'll know exactly what the next steps will be. So that was also kind of a relief to know that we weren't just relying on the MRI, he was actually going to look at it.
Yeah, it looks like we already have a question from the audience.
Yes. Thomas would like to know, what sports do you like to play, Michael?
Basketball is my favorite sport. I like baseball. I pitch and catch, and I've played flag football for 3 years now.
Do you have a favorite sport?
Probably basketball.
Okay. And you said you have a good 3-point shot, or no?
Yeah.
So that's great. So then you have that surgery, and then how long in between that surgery before you had to have a second one?
It was just a few weeks. Dr. Allen then referred us to Dr. Cordasco and Dr. Green, and they're the team here at HSS that handles the ACL repairs for pediatric patients. So we had a consultation a few weeks later, and then they were able to get Michael into surgery. So this was in October that he had the meniscus surgery with Dr. Allen, and then in November he was able to have that ACL repair.
So in between those 3 weeks, what was life like? Were you in a wheelchair, on crutches? Do you remember any of that?
I remember I was on crutches, and I wasn't really like just at home. I was going to school for those 3 weeks.
I'm sure you're excited about that. So that rehab process, if you will, over those 3 weeks, everything was going okay?
Yeah, that was actually a pretty easy rehab. He was able to get up and walk pretty quickly. He was on crutches, I think, just for a few days, and then was able to walk on it, which was a good thing because we had Halloween in the middle there. So, being 9 years old, it was great that we were able to squeeze some trick-or-treating in before the ACL repair.
And when Dr. Allen recommended that you see Dr. Daniel Green and Dr. Frank Cordasco, again, any research on them? Did you have to look into them either online, on our Back in the Game patient forum?
Yes, we did actually quite a bit of research online. I mean, it's fortunate that now all this information is available. We were able to take a look and see that they were the team that was really in the forefront of doing this. We did actually look into other hospitals. We looked into they had said, if you want to look into other places where you can have this procedure done, here are the places you can have it done. We looked into other places and decided that HSS was going to be the place that we wanted to have this surgery taken care of.
And do you remember that first encounter with either Dr. Cardasco or Dr. Green?
You know, it's funny, I really don't. Do you, Michael? Do you remember meeting them? Actually, I take that back. I do remember meeting Dr. Cordasco the first time, and the really nice thing about him was we had scheduled a follow-up appointment to have Michael's stitches taken out from the meniscus surgery. And Dr. Cordasco was seeing us as well. We saw Dr. Cordasco first. He said, let me just call down to Dr. Allen's office. I can just take these stitches out for you as long as you're up here. If he's okay with it, I'll take the stitches out. We don't have to make this any more complicated. And, you know, we talked to him at length at that point about the surgical procedure itself.
And so how did they explain that this would work, obviously being tag team and to work on the knee?
So the way that they explained it, a lot of the issues, because Michael at the time was 9 years old, he was on the small side, he didn't weigh a lot, so their options were a little bit more limited. So we did know that they were going to have to take a graft of his iliotibial band high up in his thigh, rather than the way that they do ACL repairs for adults. So that was the other thing, is that's why they have this team of a pediatric surgeon and somebody who specializes in ACL repair, that they're able to do this surgery together, that you feel like you're getting sort of the best of both worlds, that you're getting somebody who knows what they're doing on a patient this size, and you get somebody who knows what they're doing with the knee.
And again, did you have any questions, concerns? What were the thoughts going through your mind at this point, knowing it's a second surgery, it's now two surgeons that are working on the knee? Again, just what was your thought process, or what were friends and family even asking?
I think we were very comfortable with having the surgery here, having the surgery. It was very clear that Michael needed this surgery in order to be able to return to normal activity. We knew there was going to be a long recovery, and I think that a lot of that was our concern, is really trying to get a grip on, you know, at 9 years old and being a very active 9-year-old athlete, to know that he was going to be out of sports for a year. It was kind of a lot to think about at that age.
Was that tough to consider, not playing your favorite sports over that time?
Yeah, because all of my friends, they would all play, and then it was really hard. I think the hardest part was just watching them all play, and I had to just sit on the sideline.
Right. And were any of your friends or any of the parents, were they asking questions or checking up on Michael's care or anything like that?
Yeah, I mean, we're very lucky. We had a lot of amazing people in our community taking really good care of us. You know, one of the stories that we talk about is Michael was in 4th grade at the time, and had just, right before he got hurt, we found out that he made the travel basketball team that he had wanted to be playing on since he was in kindergarten. And we decided we were going to try and just let him stay on the team. We met with the coach, and the coach said, I don't know if you remember this, Michael, but the coach said, Michael, you earned your spot on this team as much as anybody else. And the team was really supportive of him. The coach was great. They really made Michael feel like he was part of the team, even though he couldn't play. And Michael went to every game. He went to as many practices as he could once he had his surgery and was recovered enough. The last game of the season, the coach stopped the game with just a handful of seconds left and asked if they could put Michael in. They talked to the other team. Michael had gotten off crutches by that point, but still had a big knee brace on, and, you know, was still definitely recovering. And they put Michael in. They let the other team know, don't guard him because you could hurt him. And, you know, Michael made a shot from the corner and it went in. And it was just a really nice way to wrap up that season and sort of make it all kind of come together.
Do you remember that moment?
Not really. I just remember after I made the shot, I remember all my friends on the team were all going towards me and high-fiving me.
And so getting back now to the surgery. So you go in for surgery, and that was inpatient or outpatient? The surgery itself, did you stay overnight here?
The ACL surgery?
The ACL,
yeah, that was inpatient. We stayed overnight. They told us at the outset it could be one night, probably one, maybe two, so just be prepared. And he was only here for one night, which was great. We were able to go home the next day, which thankfully was the day before Thanksgiving, so we were hoping to not be here on Thanksgiving.
And in terms of the rehab, what does that entail? What types of rehab were you going through, and how many days a week or how many hours were you spending, you know, trying to then strengthen up the knee?
Do you remember that?
It was like 2 or 3 days a week
Mhm.
for like an hour and a half, and it was just a lot of strengthening and stretching.
Do you remember, was it tough? Was it easy?
It was really hard at the beginning because my muscles in my left leg were all very weak after the surgery, but after a while it became a lot easier.
And obviously, as a parent, was it challenging to watch your son go through this and trying to recover and build up that strength? What were some of those emotions?
I think the very beginning was difficult because we were discharged from the hospital, and it's a painful surgery, and he had 5 incisions, and that initial just getting him to be able to bend his leg and taking care of the incisions and just getting around. That was tough. I think once he recovered a little bit more, we had great relationships with physical therapists who were taking care of him, and they did everything they could to try and make physical therapy more appropriate for a child his age. They knew he liked basketball, so if they were going to have him balance on one leg, they'd give him basketball, and he could dribble a basketball while he was doing it. So I think that made it a lot easier. Knowing that these people really were taking care of him and really cared about his recovery, and knowing that they were going to make physical therapy as pleasant as they could, I think helped a lot.
And so throughout that recovery process, were all 3 surgeons checking in? What was that follow-up like from obviously it's a collaborative team approach, so how often were they checking in and making sure that things were going according to plan?
I do know that I'm pretty sure they called us at home after the surgery, within a couple days to check in. We were back every few weeks for those first few months, coming back, getting the stitches out, checking to make sure that his mobility was okay, to make sure his strength was returning. So we would see them pretty frequently at the beginning.
And do you remember the day at all of when you came here and the doctor says, you're good to go? Well, do you remember when that was and what that feeling was?
Do you remember? Because I remember.
I don't really remember. I just remember being really excited that I could return.
Yeah, the good thing is they didn't just one day say, okay, you're ready to go, you can play sports again. It was all very gradual, which I think was helpful, that they didn't just sort of let him loose. With a child, I think they're much more careful about, okay, first you can get back on the basketball court, or you can play but nobody can guard you. It was definitely more gradual, but I do remember we were in Dr. Cordasco's office, and we had been seeing, Dr. Cordasco has a team of athletic trainers who work with him as well, and they would assess Michael's progress also every time we would see Dr. Cordasco. And we were speaking with them about it, and yep, I remember when they told us it would be okay and he could go back and play basketball after that first year. It was that second year he was able to play again.
And at what point during this journey, I understand that you met a high-profile football player that led to some other things that he ended up starting. So can you talk a little bit about that?
So I was getting my stitches out from my ACL surgery, and I met a football player, and I didn't know who it was, and then I found out, and we still have a relationship. So I decided to start a charity where I connect kids 13 or younger who have had orthopedic surgery with athletes who have also gone through injuries.
And so was this your idea to start the charity? Was this Mom's idea? How did that come about?
We were kind of thinking it all through together with also the rest of my family, and it came to a point where we decided to start the charity.
And what's the name of that charity?
Jams Pals. It's JAMS for our initials, and then pals.org.
That's great, and I guess from the time that you started that to now, I'm sure there's definitely how proud you are of your son doing something like this.
I think it's amazing. It started because Michael had been emailing this athlete for about a year, and Michael said to us about a year later, we were just talking about his recovery, and he said, I think it would have been much harder for me to get through a lot of this if he hadn't been emailing me. And what we decided, we were just talking it through as a family and decided that it would be really nice if we could kind of pay it forward and maybe have other athletes connect with kids in order to help them through this process as well.
That's great. And so you're finally you're fully recovered. What were you sharing with friends and family about the experience, or once Michael was pain-free and green-lighted to go back to sports? Were others asking you questions? Were you just going out there and sharing your story, or how did that work?
Yeah, I mean, we've talked about it a lot with our friends, with family. We've talked with people we don't know. I know there are people who have found Michael's story on the Back in the Game section on the HSS website and connected to our organization because our website is jamspals.org, and they found us through there. And I've connected with some of the parents who have had similar situations just to kind of talk about our experience here and how much I feel like they've taken care of Michael, they've taken care of us as a family, even just having that night in the hospital, knowing that the nurses were caring for Michael and also making sure that I was okay, checking in on me and, do you need another blanket? It's cold in here. Do you need some coffee? This is it's a stressful day. They really took care of all of us here.
Right, and the Back in the Game site, for those of you who may not be aware, is hss.edu/Back in the Game. Michael's story is one of over 1,700 that we have now, so hopefully that's helping to inspire others as well. So how are you doing today, Michael?
I'm good. I had an appointment with Dr. Green, and he said everything is good with my knee.
And playing sports, getting ready again for the school year?
Yep.
That's great.
Yep.
And I guess before we finish up here, any advice for anyone, whether they were 9 years old or you're 12 years old right now, any advice for those who are playing sports right now, and if they happen to get injured and need to go somewhere for care, what would you say to them if that happened to one of your friends?
That you just have to fight through it, and that because you're young, it might be a little bit longer, but it also gives you more time to play the sports you love after you heal from it, so you can't get too upset because you will get back to playing.
And Mom, same question. If there was a parent that you knew who just found out their child needed treatment, what would you share with them?
I mean, I would tell them if you have a trusted doctor, check with them. And I would also say don't hesitate to get a second opinion at a place like HSS, where this is what they do. This is their specialty. And, hang in there, because it's not easy. We look at a lot of things differently now. This experience has taught us a lot about a lot of different things. But you'll get through it, and I think, we've learned a lot from Michael here too, that, about how to be strong through something and kind of how to have the perspective that you need to be able to get through it.
Great. Well, thank you for taking some time out of your day. It's a Friday, so we really appreciate that. Again, for those of you who want to learn more about Michael, check out the hss.edu/Back in the Game web address. That's our Back in the Game patient forum. And any other questions that you might have, whether it's for his mom Jill, or for Michael himself, or for any of the doctors, Dr. Allen, Dr. Cordasco, Dr. Green, feel free to leave your questions and comments below, so even after this broadcast we will try to answer any of those questions that might come in. But anyway, thanks again for tuning in. Thanks again for being here, and hope you have a great rest of the day.